Hello, and welcome to the Coralosophy Podcast. I'm Chris Muntz, and I'm your host. This is episode 49, Cutting Through the Hype of COVID in Schools, with Dr. Tracy Høeg. Dr. Høeg joins me to discuss a topic that is directly pertinent to many of my listeners as colleagues and friends who are concerned in and out of the choir world, or at least interested in understanding how COVID is affecting school from a science and data perspective. So we take a depoliticized, hype-free dive into what has been going on in the data surrounding COVID in schools during the last few months. Should schools be open? Should they stay closed? Should it be somewhere in between? What are the risks to students and teachers in terms of data? What are other countries doing about schools? And what are the risks of not opening schools? So we really dive into the question of, has the politicization of this issue caused us to miss an important middle ground? And so apparently, I think I'll approach this way to start out the episode. Apparently, we live in a world now where people will decide whether or not they want to listen to me or to listen to Dr. Høeg, which, by the way, is taking a lot of my mental energy to pronounce her name correctly. I'm probably doing it 75% of the time. It's a Danish name, but I'm working on it. But whether or not they want to listen to us and the data we present and the science we discuss, because they will, in the back of our mind, listeners, you might be thinking about what political affiliation are we approaching this from? You might not admit that that's what you're doing, but I fear that that's what we've been trained to do. I know I've encountered this on social media, and so has she, been quite frustrated with presenting science and having it be approached as whether or not that science supports a political agenda or not. So I think I'll start out by kind of giving you a disclaimer of where I'm coming from. You've heard me talk on the show, if you're a regular listener, quite a bit of my feelings about how politics affects this type of stuff. I'm not a fan. I tend to be distrusting of politics as a mechanism for making really big, important decisions. But for me, this is COVID has never been a political issue. For me, with the risk, running the risk of getting a little bit too vulnerable and personal here on a public podcast, for me, I have been approaching this from a standpoint of risk balance. So what is the risk from COVID understood in the best possible scientific language and using the best scientific data? Because I want to know how my family and myself should respond, keeping in mind that if we do too much in either direction, we could also cause harm. So here are the things that I see. I see people in my life who mean a lot to me, who are on suicide watch right now, mostly based on isolation, hopelessness, lack of ability to plan, all of the things that trigger anxiety, depression, and suicidal ideation. I have people in my life that I care about, that I will not lose. So for me, there is harm. It's very real, and it's not political at all. When I talk about not wanting to overblow how scared we are of COVID, right? There is such a thing as overreacting to it. Absolutely. There is also underreacting, which the doctor and I will talk about later in the episode. So that's one aspect. Another aspect that I see in my own personal life, not political, is that my wife's mother recently passed away. You heard about, if you're a regular listener on the show, you heard me do a little moment of silence for her a few weeks back. Well, I didn't really tell you the story, but because apparently we live in a world where you need to be convinced that I'm not a political activist, we lost her because of overreaction to COVID. She felt a lump in her breast in March. She was very, very afraid of the virus and decided not to go get it checked out. 6 months later, she finally did, and it was too late, and she died in September. This is not a political episode. What I am trying to do is I am trying to help us understand the best information we possibly can with a qualified professional so that we can react in a non-political way. What is best for kids? What is best for adults? What are the ways that we can minimize the risk in our society while not completely shutting it down? Because we also recognize that by shutting things down like schools, we cause real damage to children, to their futures, the trolley problem is real. So with that disclaimer, I will continue to push on through the episode, but I did want to make that statement at the beginning, just so that you could, I guess you have no reason to believe me when I tell you that I don't have political dog in the fight here. Which party in the U.S. that I care is the one that is seen as smart. I just really don't care. I care about my students at school. I care about my biological kids. I care about society at large and wanting to figure out what's best. Okay, on a lighter note, some announcements coming up. We have the convention in Atlanta still on its way in April. Lots up in the air. I know we've got COVID coming surging, and then of course we probably will go through a period where it fades away again. And so that's why we picked the date in April, optimistically that we would be in some kind of a recession from viral surge, and maybe we have a vaccine by then. So with that uncertainty, we tried to plan a convention that could be relatively easily canceled if we needed to, due to things that we don't foresee with COVID. But again, wanting to take some chances to get together and have a safe, socially distanced convention with a small number of people so that we can learn from each other and actually communicate, which is also very important for our mental health. So check out coralosophy.com. And then there is a /coralosophy-con that you can find information about that convention, or you can find CoralosophyCon 2021, a small Facebook group of people interested in putting that convention together. So wanted to let everyone know that I made a couple updates on the main page of coralosophy.com. I added a email list, which is not a spam list. It will be sent out. It's going to be a newsletter sent out once every other month, which will simply consolidate all the episodes that have happened in the last couple of months in a short little email with some links, so that for those of you who don't regularly check the feed or regularly hang out on the Coralosophers Facebook page, you can just be reminded of what guests came on, what topics we discussed. Because as you know, one of the reasons I think podcasts are cool is because you don't have to listen to all of them. You can kind of pick and choose the topics on my feed that you are interested in and hunt and peck a little bit. And so this email will just drop in your mailbox every other month and remind you about what guests came on and what did we talk about. There was another addition on there is I put an application to appear and or comment form on the main page of the website, where if you hear something on this episode or if you hear something on a future episode that you simply want to respond to, it could be that you would like to respond on the show. It could be that you just want to send me a response to something that super problematic that you heard me say, or that you liked that you heard. Could be an idea for a future topic. But there's an official window created now where you can comment there on the main page of the website, coralosophy.com, and have a response that's off social media, because sometimes people feel uncomfortable making public responses to shows like this. And so that is available to you. Finally, before we get to the interview, we have sightreadingfactory.com is a way, especially as schools are opening and closing and going back and forth, that you can keep assignments working for your kids, whether they're there at school or whether they're at home. You can get a membership for yourself and all of your students by signing up at sightreadingfactory.com, and then you can get 10% off the whole order by entering Coralosophy at checkout. Also, at the mymusicfolders.com website, we have the fantastic and absolutely worth the money Resonance Singer's Mask. The kids that I have at school wearing these are loving them when compared to other masks that slide around and fall, and they're very good quality, very good protection, and they're coming out with an upgraded version. Think of it, Resonance Singer's Mask 2.0. So head over there and check those out. I'm going to be showing you a prototype of that second edition soon, with some improved safety features and some improved quality as well. So keep that in mind. Plus, if you need things like choir folders, choir robes, mymusicfolders.com and mychoirrobes.com all have a coupon code for Coralosophy at checkout that you can get a discount every time you go to those websites. So now let's move into my conversation with Dr. Tracy Høeg. Okay, everybody, I'm here with Dr. Tracy Høeg, and she is a physician and an epidemiologist, which I'll let her tell you a little bit about. But we're here to talk today about the issue of the school safety concept around COVID. How safe is school? How unsafe is it? How safe for kids? How safe for staff? That kind of thing, because I know that's a topic on a lot of your minds listening to the show. So Tracy, welcome.
Thank you. Thanks for having me.
I'm excited to dive into this topic. Before we do, why don't you tell us just a little bit about yourself, where you come from, and why it is that we should listen to what you have to say about this topic?
All right. Well, I am an MD, PhD, so that means physician, scientist, and I'm originally from Wisconsin, and that is where I received my MD. And I did my undergraduate in French. And then I ended up moving to Denmark with my Danish husband, and I did a PhD in epidemiology at the University of Copenhagen, and we lived there for 7 years, and then we ended up moving to California. And at UC Davis, I did my residency in physical medicine and rehabilitation, and then I did a fellowship in Napa in sports and spine medicine. And I became interested in COVID in children, for a number of reasons. So I have children. I have two children that are my own children with my husband, and then I have two stepchildren who are older. And so I became interested first by following a fellow epidemiologist. Her name is Jennifer Caston, and she did basically a review of the literature back in the beginning of April, looking at COVID in children. And she said that she couldn't find any instances of children passing COVID on to adults. And this was really odd because this is not the way that infectious diseases usually work. And so I just became intrigued, and I joined a group of physicians that were discussing how to safely open up schools. And then there was another physician in that group out of the University of Colorado who was compiling data, and she came to the same conclusion that she looked at data from all over the world, and she couldn't find any instances of children passing on COVID. And so people were tossing around the terms of children being a viral dead end. But no one really wanted to say anything for sure because we had really limited data at that time. But it was still a really fascinating point about the disease. I felt like we didn't understand, and I've always been very interested in looking into medical topics that are outside of what our current understanding might be, and different from the norm. And at the same time, the schools in Denmark, the elementary schools, opened up. And that was April 15th. And I was following that really closely with our family. We always watched the Danish news and Danish television in our home. And nothing happened. Like, their prevalence rate, the test positivity rate, went from 6.9% to basically zero over the next few months. And they were able to, after they open up elementary schools, open the high schools and open the rest of the economy. And it was like, there were scattered positive cases in the schools, but nothing that really spread further. And so then I thought, okay, well, it's just going to be a matter of time, and the United States is going to open up the schools too. And then I watched as country after country in Europe and Asia opened up their schools, and I'm like, okay, well, we're a first world country too, right? We're going to open up our schools soon, but like, it just never happened.
Yeah.
And so it's been really interesting to watch from the standpoint of a double citizen American Dane. Like, why is there this huge disconnect?
Yeah.
Both scientifically
Okay.
and
Well,
culturally.
let's dive into that a little bit, because I think a good way to start the conversation could be kind of digging into this concept. You mentioned your qualifications to kind of think about this topic as a physician, as an epidemiologist. Um, there are, well, let me just float this idea to you and let me see what you think. The issue of opening schools is a topic that, in my perfect world anyway, would include expertise, like where everybody's talking about trust the experts, right? But expertise in multiple fields. It would require a conversation kind of balancing risks versus other risks, right? So what are the risks from COVID directly to the kids, to the staff? But then we'd also have to talk about the risks of not opening school, and what causes, like, what kind of downstream effects could that have? What kind of effects you might need to even bring an expert in economics in to talk about the effects of parents not being able to go back to work and what that would do to, right. And I think in the US, and maybe this is where some of the unique ineptitude of our reaction to this is we seemed to hyper focus only in one area. on that. And I think that because we were afraid of the virus, we didn't open schools. How crazy does that sound?
No, that sounds right. And I mean, certainly we have been correct to be afraid of the virus, but in the United States, everything has been extremely polarized. And I think that has a lot to do with the election, a lot to do with the way the political system is set up here. And people were either in the camp of I care about COVID or I don't care about COVID. And it kind of got to the point where, you know, it was people were only looking at the science, liberals basically were looking only at the science of what is COVID doing and how can we stop any spread of COVID. And then it was like the opposite end of the spectrum. People were looking at, well, what are the effects of prolonged lockdown and who does it affect most? And really all along, we should have been having a conversation that, weighed both sides of the story. So that's
Right.
been lacking.
Yeah, no, I agree. And that's actually something that the very first time I dove into this topic on this show was with Amish Adalja back in May. And one of the things he told my audience then was that the challenge will be to, what he said was, right size the response, to not overreact or underreact. And that will be the challenge. But I totally agree with your analysis there. We got either the COVID is fake and it's a hoax reaction, or COVID is the apocalypse and we need to not leave our house and not do anything until it's gone. And that seems like those are the two choices in the U.S. that we've got. And I think you're right. It has to do with the way our political system is set up. They have to go to opposite ends of the boxing ring
Yeah.
before they start, and obviously the truth is going to be somewhere in the middle. And so one of the things that I think would be good for you to help us understand is where is that middle based on the best information right now. As you mentioned, there's this growing amount of data that we didn't have access to in March, and I think I remember when we were talking earlier in the spring about maybe kids can't even get sick or can't even spread it, and I think we know that that's not exactly true, but there is a difference. What are some of the more compelling things that you've seen so far, that suggest that there is some how are kids different? In other words, let's start there.
Yeah. So, one thing about COVID is the mortality rate is much higher the older that you get, and so estimates right now based on infection fatality rate, or IFR. So if you actually get infected, you may or may not have symptoms, but the infection fatality rate for children under the age of 18 is 0.001, which is actually lower than influenza in that age group. And it's actually about age 30 that COVID is probably more deadly than uh, than uh, than influenza. And so, that already kind of makes us think, all right, well, we've always had schools open during the influenza season with children there. And so, maybe that's, maybe we're doing a little unnecessary harm to the kids. And then, I mean, kids certainly get COVID, and they can pass it on. We know that there have been instances where kids have passed it on. And within the family, there was a good South Korean study that showed that children pass it on to 0.5% of the time. So 1 out of 20 kids that get it will pass it on within their family. And then an Indian study kind of clarified that a little bit more, showing that if they pass it on, they usually pass it on to another child. So it's actually a very low rate of transmission. So if we say 1 out of 20, that's a very low are not. And so they're way below adults in terms of passing it on to another person. So there's that difference. And then we know that adults, they can pass it on to up to 50 people at a time. So that's another interesting point of this disease, is the dispersion. So it's like we have these super spreaders. So far, all of them have been adults. There's not, to my knowledge, been a child super spreader. And then we have these kids that basically it's not we can't say it's a dead end, but it basically doesn't get transmitted among them. It's not an R naught above 1, so it doesn't tend to accumulate among children. So and
Right.
then the amount of sickness, like the amount of that children get admitted to the hospital, is also exceedingly low. And but when you get up to above 80 years old and you have multiple risk factors, the mortality rate is very high, and so that it's a disease that preferentially will negatively affect older people. So yeah.
Right. And I think that's another issue that we're facing, is that when most people hear what you just told them, we're conditioned by media stories to say, yeah, but there was that one.
Yeah.
And
So
don't you, why don't you care about that person, you monster? Um,
right. So that is such an interesting point, because if you show people like one starving child in Africa, they tend to care more about that one child than reading that 10,000 children are starving, or it's like we're all conditioned to really care about the anecdote of one human and not look at all the data.
right.
Um, yeah.
Well, yeah, and that's an interesting point that you bring up, because the UN says that there are 10,000 extra kids a month starving right now because of economic downturn,
Yes,
because we're not doing
exactly.
anything.
And
And that's that part of that, you have to weigh risks against other risks. And this has kind of been my interest in this topic as a layperson, is that I kind of see the world crumbling around us because we're not balancing the
yes,
risks against each other. But let's go back real quick to IFR,
yeah,
infection fatality rate, real quick, because that's another one that when I feel like this is something, because like I said, as a layperson, I've been really interested in this topic since May, and whenever I post the latest information that I can find about IFR, invariably I will get somebody who responds with the following criticism, which is that we just don't know enough information about that yet. And of course, they've been saying that. I get that Facebook post. I've been getting it for 6 months. So, what how would you explain to someone how IFR works, especially in the context of a virus like this, and thinking about SARS and MERS, that to my knowledge they didn't never even estimated on IFR because there was not enough information,
yeah.
but now we know a lot more about this.
Right. So the study that I have looked at the most regarding IFR is from Ioannidis, who is from Stanford, who did a review from around the world of different countries, looking at the infection fatality rate of the countries. It was actually cities too. Basically, all the studies that looked at the infection fatality rate based on seroprevalence in the population. So people with antibodies to SARS-CoV-2. And so he found that on average, the IFR was 0.26%. However, New York and Louisiana, I believe, were the highest, and Northern Italy had the highest infection fatality rates. So IFR is going to vary a lot depending on the attributes of that population. So like studies out of Africa, where the average age in the study was a lot lower, you're going to have a much lower infection fatality rate. And then, I think when I look at the data, and especially from Monica Gandhi at UCSF and Ernest Rutherford, that there is something about the infectious dose. So also, leading to more severe disease. So people that are living in more tightly packed quarters, not wearing masks, may have a higher fatality rate. I think that we don't really know for sure yet, but that's definitely a theory that is out there. And then places that had like a really high caseload initially early on, and where the health systems were overwhelmed and we didn't know the optimal treatment, like New York City and like in Northern Italy, they also had a higher infection fatality rate, because we just really didn't know how to treat it
Yep.
that well at that time. So
Yeah,
yeah,
that's another. I've had another conversation on the show too regarding the concept of with every viral outbreak in the history of mankind, CFR, IFR starts out high and gets lower because you
yeah,
don't know how to treat it at first,
yeah,
and so yeah, that makes sense. And that paper, by the way, that you're referencing, Dr. Ioannidis study, has, I don't know if you've seen this, but has been peer reviewed and published by the WHO.
Yes, exactly. Yeah, I should have mentioned that. Sorry.
Yeah.
Yeah, that's true.
So, and the reason how to me, and again, I'm a layperson, but to me, that does signify some level of legitimacy if not only our CDC, but CDCs from countries all over the world and the WHO are publishing IFR estimates, then we must have enough information to at least publish this.
That is also how I interpreted it, and it was shortly after the WHO published that they started to recommend against more systematic lockdowns, or like as that it was too blunt of a tool to be
Hmm.
using given the overall IFR. So yeah,
Yeah.
I think that we have some idea what the IFR is from the beginning, of the not the very beginning, but I would say end of March, beginning of April. I was basically saying that I thought that the infection fatality rate had to be around 0.5% from what we had seen so far, and all my calculations were based on that, and that was out of the zero prevalence, or that was out of the prevalence data that we had from Iceland and Germany, because they were doing the most testing at that time. So
Mhm.
what was found after that was, because I think we were adding younger populations as well as improving our treatment. So yeah.
Absolutely. Yeah. And one thing, just, I don't know if you noticed this, but I find this to be very ironic and just so 2020 that I can't even handle it, which is that Dr. Ioannidis had his videos censored off of YouTube back in the spring. And the charge was publishing things that go against the WHO. And now they have published his paper.
Ah, it's kind of like revenge. That's interesting.
It,
Well, he's a brilliant person. If the listeners to this haven't heard him speak, he is quite the mathematician, and I understand he wears a very nice white suit. I actually haven't seen it, but I would like to. I could have looked that
yeah.
up after this.
Yeah, it'd be interesting. Yeah, I think some of his videos are still up on YouTube, but he had some taken down because he was putting out that IFR was likely lower than people were saying,
Yeah.
and now
Yeah.
that is the most recent information by the WHO. So it's
Right.
amazing how science has been treated by that. But in the
Totally.
last 6 months, and what my take has been that lay people have confused trusting science with trusting a particular group of scientists,
Yeah.
and
Yeah.
that's not the
Definitely.
same thing.
Right. Right.
Science is a process of here's what I say, and then other scientists saying no, you're wrong, and this back and forth, and here's my research that refutes your research, and
Right. Right.
and that process has been perverted in a lot of ways. So here's another way to think of this and frame this for people. So it seems like you think, based on, and I don't want to put words in your mouth, but it seems like the information that you've seen makes you think that school is a pretty darn safe thing for kids to be involved in right now. Is that correct?
Yes, I think that's fair to say. Kids particularly, because they have a very low mortality rate. I've actually done research into long COVID or lasting symptoms of COVID in adults, and that's been pretty interesting. But I haven't seen any evidence of that so far in children. I'm not saying it doesn't happen, but that's been interesting that we haven't seen that either. And we have data from schools all over the world showing that opening up schools has generally been going well, not associated with, large amounts of hospitalizations or increasing cases. And we basically we've been seeing it's been tried in Europe, and now they're continuing to keep the schools open there because they continue to feel that it's actually the safest place for kids. And part of that is, well, it's not because there's no risk to kids, like we talked about, less mortality than influenza, but it's because there is so much safety and so much benefit for kids to being in school. And especially the teenager age, even though that they're probably transmitting a little bit more than the younger kids, there are a lot more issues with suicide and suicide attempts and mental health issues. And we really need to be keeping track and talking about that, what's happening to our kids, because it's very, very scary. And I feel like right now that parents are the only ones who are seeing these things happen to kids, and it is heartbreaking. It is very, very scary because they are young and this can impact them for the rest of their lives.
Absolutely. Yeah, I'm a high school age teacher myself, and um, when I see people respond to what you just said, which is that we really need to be considering the mental health of kids. And I've heard people say that just even saying that is a political, you're making that political. And if they really cared about their mental health, their parents would watch out for them. And that really ticks me off because I see these kids and they are in crisis. You know,
Yeah.
they're and we in my district we are in hybrid, so I see them twice a week. Um, and they're still in crisis because school in that way is really hard on them like emotionally, seeing their teachers twice a week and then going home for 5 days with no structure, and mom and dad are at work, and it's a nightmare. And so it's being in what's and this kind of ties into this political polarization thing that seems to drive you crazy, and it's definitely drives me crazy. But you saying that it seems like school would probably be a good idea for kids. Why are you a right-wing wacko?
Yeah. Since when is caring about mental health a right wing wacko thing to say?
Exactly. Exactly.
No, yeah, it is really crazy. I mean, I remember at the beginning of the pandemic, I haven't forgotten that when we all thought that as physicians, we all thought we're like all going to die because we're all going to get COVID and we're going to die, and we were scared. And then people were like, "Well, what about mental health?" And at that time, I was like, I mean, can we just focus on this thing that's like about to kill us, that's knocking at our door, and then we'll talk about mental health? But now it's like months and months and months later. And
Mhm.
it's like, okay, well, we need to talk about that now because we're really seeing that, the solution is worse than the disease in especially in kids. So yeah, I mean, things have changed, and people have to realize that just because you say something in March doesn't mean you still believe that exact same thing in November.
Right,
So,
exactly. By the way, we had been exchanging some emails before that we started recording. Did you see that the Brown University dashboard got updated again?
oh, like just today?
Like today, and they've even got like
No, I
some
didn't see that.
pretty graphics. I'm going to share something here with you. Going to bust in for a quick announcement, reminding you to head over to Patreon. Patreon.com/Coralosophy is your window behind the scenes into this show. There are several reasons that you might head over there and participate voluntarily in that community. There's a group of over 60 there now who are simply supporters of the show because they believe in what the show is trying to do and broadening the conversation in choral music and in education and all the things that we talk about on this show. So sometimes you might just want to chip in $3 a month just to say thanks. But there's also extra content there. There is a private podcast feed that you can access. You can set it up so that it pops directly into your other podcast feed right alongside the main show, which, by the way, will always be free. But this is a very important resource for me to be able to underwrite the recurring costs of the show. So patreon.com/Coralosophy if you'd like to chip in and or access that extra content. We also have a producer level over on Patreon. The show is produced by Steve and Kathy Kakachik, Ryan Main, Michael Herron, Kyle Peterson, James Mock, David Kowalczyk, and Ulrika Igrain Munoz Alarcon. Thanks to everyone over there, and feel free to head on over there and join that group. So they included this pretty little graph here with data on whether or not the school is full capacity in person, whether or not it's hybrid, whether or not it's remote only. They've got like this statewide, state by state map of who's participating. I noticed that the number of school responses shot up to like close to 6,000 schools. And they've added this most recent week or most recent time period of 10/12 to 10/25, which I find really interesting. So they've got that kind of fourth data point there to compare. And the part I wanted to ask you about, because we just talked about students and we talked about how the IFR for student age kids is just so close to zero, it's hard to even fathom, lower than influenza. But what about the teachers? So the teachers are oftentimes very nervous and very scared. Is there information that you've seen on this Brown dashboard that that informs how nervous a teacher should be if they come back to school?
Right. So, I mean, the data that I have seen that has been reassuring to me is that the infection rate among teachers has been higher in the schools that are doing full remote learning than in-person learning. And we really need to look at that in the context of the community prevalence of the disease, but that's certainly reassuring,
I'm going to bring it.
suggesting that there's not a lot of transmission from student to teacher going on. And we haven't been seeing any outbreaks. When the last I looked at the data, there were 0 outbreaks of 10 or greater people in any elementary schools across the entire country.
Let's talk about that for a second
0.
again. There are the outbreaks for staff or cases for staff are higher in remote learning.
Right.
So when they are not even seeing kids,
Yeah.
that goes so far the opposite direction of what the narrative is for most teachers. Why?
Exactly. Yeah.
How could that possibly be true?
Well, so if the places where they're doing remote learning, if the community prevalence is so high that they've chosen to do remote learning for that reason, that might bring up the prevalence among the teachers. However, we've been kind of doing studies looking, not me personally, but we, the royal we, like we have been looking at studies from across the country of where schools are open and where they're closed, and it's basically been along political lines. So like more liberal counties and states have been keeping full remote or hybrid, and more red conservative states have been opening up their schools. So I mean, I would really like to see the data from the dashboard in the context of the community prevalence, but I don't think that places are necessarily always closing only because of the community prevalence. And one good example of that has actually been New York City. That's not specifically on the dashboard, but that they have been finding a decreasing rate among their everyone, students and staff in the schools. I believe it was 0.15% positivity. And then the community rate in New York City has been like 1.5, 1.7%. So really low rate in the schools among the students and the staff. So that's been reassuring too.
Right, which and that's what's I find interesting about it, and I think teachers that are listening to this need to notice this as well,
Yeah.
that it seems, and it does, and according to the Brown dashboard, which, like I said, now has about 6,000 schools that are reporting their data, and I think something like 9 million students, inputted into this. So again, not a small sample size of what's going on here, where it seems like no matter what the learning model across the country, the rate of spread in schools is quite a bit lower than the rate of spread in the community.
Community. Yeah, exactly.
So
Exactly.
now again, I'm a layperson, so I interpret that. This probably is an oversimplification because I'm not trained in this area, but it seems to me like I would interpret that as school is generally a safer place to be than the general community would. And my instinct is because we're following a bunch of rules that
Right.
other people
Yes.
aren't following.
Yeah, I definitely think that has to do with it. I think it's because there's a lot of kids there. I think the kids basically have been staying in the same cohort. The kids are not passing it on a lot from what we can see. Now, I would talk about masking, but um, I just want to say that in Europe, it's been super interesting that most of the countries there, when they opened in spring, they weren't doing any masking among the kids, and they still weren't seeing any outbreaks. In fact, in Holland, it was only 1% of the total cases came from kids for the whole country, even though they had the schools open there all spring, and they weren't wearing masks and they weren't distancing in schools. So Holland's kind of like the example to me of like they actually didn't do anything differently. And
Mhm.
they still had really, really low rates in the schools, so low that in the elementary schools, they're actually not having the kids quarantine if they were exposed to another kid who was positive, because they just have looked at the data and they're saying, well, the kids aren't passing it on to the kids so in school. So we're just not going to do quarantining in that way. So, I mean, I'm not saying that they're doing everything right, but that's been interesting to follow them. And I feel like in the United States, we're doing a lot more in the schools that are open to stop the spread of the disease. And so we could pretty much expect things to even go better, perhaps there
Right.
here than there.
Yeah,
So
and it stands to reason to me that also there could be that element of a teacher who is working in a remote only environment is spending a higher proportion of their time in some of those cases, especially if they're teaching at home.
yeah,
Some school then around other people, and of course, correct me if I'm wrong, but the highest rate of transmission occurs during some kind of cohabitation. So people are getting it at home or in care homes where
yes,
people live together.
yes, exactly.
And
That's what
so,
we're
if
getting.
you're a teacher teaching at home, then you're always with your germy kids and your germy husband and your
Yeah,
whatever. You're always hanging around. Whereas if you're at school during the day, you're leaving the house, going into this environment where everyone's wearing masks and distancing, and in schools most of the time you've got larger spaces with higher cubic feet of air. You've got so there's that just kind of ventilation, circulation, doors always opening and closing. It just, I mean, again, I'm not, this is not what I do for a living, but that just seems logical to me that the school might be one of the safer places that I go during my week, for example.
yeah. I mean, I generally have the impression that schools are overall safer than most places. I wouldn't say so. Okay, if an adult is teaching from home and they're only at home and they never go anywhere else and they're
Right,
they're really
right,
not going to get very much exposure to anything, but that's not really what we're seeing. I mean, we're
right.
seeing adults going out and doing other things among other adults and having gatherings and going out to eat, and so I'm not saying that they're doing that more because they're not teaching in school, but that's where we're seeing it being spread, and not in the school. So it's kind of those activities. So if I were kind of guiding the country, I'd be like, well, we have to open up the activities that are safer and focus on really kind of surgically closing the things that have been associated with super spreading and the most cases, because like we were talking about before, with the dispersion or the K of COVID is very high. So you just have these events where maybe it involves usually being indoors. It's 18 times more likely to be indoors than outdoors. It's usually involving places where masks are not possible. So people are eating, people are drinking together in close quarters. And then the more people you have there, the worse the super spreading event can be. And so, like, I feel like things like that, we need to focus on kind of shutting those down and like opening up outdoor things, opening up the elementary schools, opening up, and workplaces have even among physicians have been found to be actually quite safe, because even though physicians are caring for people with COVID, they're wearing N95s. A lot of them are wearing eye protection, and like we're doing things to make it safe, and it's pretty much working now. I mean, in the beginning there was a shortage of the PPE, but now it's working much better. So it's like we have a lot of things in our society that we can be opening up safely.
Right. And let's do talk about masking a little bit, because I think that in my school, everyone wears masks all the time. It's required, and I think that's the case in most schools that I've heard of anywhere across this country, anyway. And so that contributes to it. One of the things that I have been concerned with a little bit, because of course I'm in the singing world, as you know, and as an industry, we've been highly focused for months on the aerosolization of the virus before even the CDC was admitting that aerosol was an issue. Occasionally, the singers were already thinking about it, because this
Yes,
was,
exactly.
we were
Yeah, and
seeing
I was too. Yeah.
yeah, we were seeing the stories in the New York Times about how singing would kill the whole world. If people would say, if you open up and sing a note, you'll kill 10 people. And that was the news headlines. And so we started digging into this. And so I know a little bit about this just from watching and tracking those types of studies over the last few months. And one of the things that I've found as from the public health messaging standpoint, and feel free to tell me that I'm crazy with this too, but when public health officials talk about mandatory universal masking. Like every time you leave your house, you should be wearing a mask no matter what you're doing. You don't care if you're by yourself, you're outside, whatever. Because there are cities across the country that have rules like that.
Right. Yes.
And
Yeah.
and
San
my my
Francisco.
my concern my concern with stuff like that is it's unscientific, and
Mhm.
it's so blatantly unscientific that could in some ways be driving some of the anti-mask crowd
Yes.
in a logical way. In other words, they're looking at it and going, BS, there's no way I'm wearing a mask by myself while I jog in the woods. Like, what are
Right.
you talking about? But that's the rules. And then we're being told to trust the experts, and the experts are the one making the rules. And so when they see stuff like that, they're just like, screw it, I'm not going to pay attention to any of these people. And
Yeah.
so what, so I've been frustrated from the beginning of why, instead of saying universal masking, everyone should wear a mask all the time, why don't they tell us wearing a good quality mask correctly in the right situations will make a big difference, and then teach us how to do it.
Yes. No, I completely agree with that. And I mean, and I'll just share a little, story from the running community, since I'm a runner, is that, I see people out running on trails in the middle of nowhere that have masks on, and I'm like, well, what do they think that they're doing? I mean, you're not going to be you need a thousand at least infectious particles to infect someone. And so in order to be considered a contact, and I believe that the CDC is basically still saying something like this, that you need to be within 6 feet of someone for at least 15 minutes to actually be considered a contact. And so, like, being 20 feet away from someone outdoors like that, it does not make any sense from a scientific standpoint to be wearing a mask at that point. I mean,
Right.
so the aerosolization or the airborne nature of COVID has definitely, brought in concerns, but that should be mostly, we're talking about indoor settings that don't have air that's circulated out. And so that's where we can really see the aerosolization or the airborne transmission of the disease, in those sorts of situations where the air is recirculated back in or it just can't get out.
Hmm.
But that's not the case for outdoors.
Right. Yeah, that makes sense. And there's like you mentioned, there's the whole concept of N95s. Those are actually filtering out the viral particles as you breathe in, or at least a portion of them. But most of the cloth masks are not. In which case, we're getting certain types of protection, but some people are using them as a talisman, almost like a magic protection against the virus because they were told to wear them, and it's become this like moral thing
Oh yeah,
rather than a scientific thing. And I think that's harmful in the long run,
no,
because
I
it will
agree.
cause people to not analyze what it is that they're doing. So
Yeah,
I heard another doctor on a different podcast talking about the just the concept of, if you're wearing a cloth or not a non respirator type of mask, you're more likely to get it by hanging out in 2 feet away from someone with masks on than you are 10 feet away without a mask on.
mm,
It's again, some people are thinking, well, I've got my mask on, I'm safe. So they're doing all the
yeah.
things. And so again, that's why I think it's harmful. Like, just teach us what is happening.
I think, and that is actually that is a tough subject, because it like requires knowing like what type of mask is the person who might have it wearing, what type of mask are you wearing, like, and so it's a really tough choice. Like, is it better to be 6 feet away, or is it better to both be wearing a mask? But it probably depends on the type of mask that you're wearing. And yeah, I do find that to be a tough subject, but I'll get back to an interesting point again about the infectious dose, and I won't harp on that too much, but that in cruise ships where people were masked, they had a surgical mask, versus in a cruise ship where no one was masked. There was so in the masked group, there are 80% that had no infections, even though they got the virus. And in the non-masked cruise ship, now this was the same age, he's basically the same age, all older people, there were 8% that did not have symptoms. But of the people who were infected. So there was actually a high amount of infection in both of the groups, but the second group was very highly asymptomatic if they were wearing masks. So they were universal masking. So I thought that was a pretty interesting little accidental, like, kind of control study.
Right. Right.
uh,
Yeah,
yeah.
no, that does make sense. I mean, in a non-filtration device type mask like that, it's still going to get in there,
So
but
that's a surgical
less.
mask that they were wearing though. So that's actually a pretty good filtration device. I think it's about 95% as effective as
Ah,
an N95. But now there are more data coming out, like, suggesting that the 3-ply cloth masks are better than the 1-ply. And so I totally agree with you that I think we need more information on exactly what type of mask that we can be wearing, because yeah, we don't want people thinking that they're getting protection from, like, some crocheted mask that's,
yeah.
yeah, with holes in it and all that. So
Yeah, and
yeah.
I think too, I feel like there has to be some conversation too about when and what types of situations the mask's effect is relatively negligible, especially related to outdoor activities, because I also feel like that as a population, their mask fatigue as a psychological effect
Yeah.
will come into play too. And I think if we're going to be dealing with this for the next year or two, like some people are saying, I
Yeah.
kind of want people to be still. I don't know. I feel like I think in the long run we might be reducing the overall harm by informing people, go outside and take your mask off and breathe some fresh air, because you're not, outside you're pretty safe. But then when you go back inside with people, put it
Yeah.
back on.
They're back on. Yeah, I
You
totally
know,
agree with that. People need a break from it. And I guess my rule of thumb is, if I'm outdoors and I'm going to be within 6 feet of someone who's not within my circle for over 15 minutes, probably less than that, I'm going to wear a mask. But beyond that, I'm not wearing a mask when I'm outdoors. If I'm just going to be passing someone on the street, because the air, it blows around, you're not going to get enough of
right?
a inoculum to get infected.
Right. Yeah. Of course, and that's so logical. But again, it's become a moral talisman or a spiritual talisman at this point.
Yeah.
Um, but let's get back real quick. I've really got kind of two more topics to hit with you, and I think we will have really dug into this. So kind of back to we kind of drifted to mask, but let's go back to the nervous teacher. Worried about coming back to school. So we've already talked about how, in a lot of ways, the school is a lower transmission environment than the general community, and we've talked about some data for that. And I'll be putting in the show notes the link to the Brown University dashboard that we showed. And but let's talk a little bit about IFR for teachers. So we're talking about I'm on the CDC's estimate. Have you looked at the CDC's estimate for this?
I know it's probably higher than the WHO's estimate, but
Yeah, I've got it back up on the screen here. We've got their best estimate. So we're looking, and most teachers fall in this age 20 to 49
okay.
at that 0.02%.
Okay.
Um,
Yeah, that sounds about right. Yeah.
yeah, yeah. And then, of course, if you're a teacher in the kind of towards closer to retirement in age, that age 50 to 69 bracket, you're looking at 0.5%.
5%. Yep. Yeah.
Um, and
Higher.
then if you're over 70, there are very few teachers that are
Right.
still
Oh,
teaching
for
that are
sure. Yeah.
over 70. It does exist, but that's where the risk really shoots high up above, up to 5% or more.
Yeah.
And so the reason I'm showing screen sharing that with you,
You. I
because you'd
appreciate
been
it.
looking at the Ioannidis paper, and I wondered if that seemed to be a similar range than what you'd seen other places.
It does seem similar. I don't remember the exact IFR from the Ioannidis paper for the different age groups. It actually maybe even looks a little lower than from the Ioannidis paper. But yeah, I mean, it is, if you're over if you're over 70, it is more dangerous. And then there's the comorbidities issue, which I mean, obesity is definitely one of those that we know is a big problem. And so that, yeah, I think that certain teachers, who feel that they're in a high risk age group, like they're older and maybe they have comorbidities, that we should also be, trying to give those teachers options. I mean, that they maybe don't have to teach in person, and kind of focusing on getting, the teachers that are, under 60 or under 55, doing the in-person teaching. So, I mean, I think that would be fair. I mean, I feel like, at least we need to come to some sort of compromise for our kids.
Yep.
And, I mean, I just feel like that's what we're not doing right now is we're just not really having any discussions, about how to do this on a very broad nationwide level, which we really need to be having.
Right.
Um, yeah.
Yeah. So, and of course, one of the issues that almost anytime I talk with people trying to spread the word about IFR, one of the reasons I do that is because I find that speaking, especially on social media, I've a pretty large platform here, and 5,000 Facebook friends, and they're all teachers, right? So usually when I bring up this stuff, the first response I get related to IFR, if it's not that we just don't have enough information, the second one is that, well, it's about more than just mortality. It's
Mhm.
about long-term effects, and people get really sick and all those things. And I get that, and I understand that. The reason that I still think it's important to make sure people know the best, latest information on IFR is, and I don't know if you've noticed this, but I've noticed a huge issue with lay people confusing CFR with
Yes. Yeah. Of
IFR.
course. Yeah.
In other words, so if I'm nervous to go to school as a teacher because I think 3 to 5 out of 100 people that get this disease die from it.
Yeah.
Because I've been seeing that number on the news, and I didn't understand that case fatality rate does not measure the risk to the individual infected person. It basically, it's severity bias, right? So it measures the risk to the sickest people.
Exactly.
Um,
Exactly. So, I mean, our case fatality rates are based on people who are actually diagnosed, while they have the disease, and so we're much more likely to be diagnosing people who are having symptoms, and people who are having mild symptoms are much less likely to get diagnosed. There are also many people who don't have symptoms at all, and now we're catching those people, and so that is actually dropping the CFR. So, because of screening testing, we're dropping the CFR, but based on the seroprevalence studies, so just looking at antibodies in the population, we're seeing that a lot more people are being infected than we're catching.
right.
And so it's definitely reassuring, that this case fatality rate is as low as it is. And, I just want to say, that I have a lot of respect for the teachers and the fear that they're feeling, because as a physician, I see patients all the time, every day, who could be infected with COVID. And I don't want it either. I don't
Right.
want to deal with long-term effects. And I'm 41, so I'm pretty low risk. But and really, I mean, we know that anything can happen. But what I will say is that, I wear a mask. I wear eye protection. I feel like, these are things that the teachers should also do. I know people aren't very into wearing eye protection, but I'm kind of like, well, why not? I don't know. I don't have to wear glasses, but there have been studies showing that, that there probably is an effect of wearing eye protection as well. And then, that you get to go back to work. And once you go back, you realize you're fulfilling, your role in our society. Right. And that's a big deal. And it's a big deal to kids. It's a big deal to our whole society, because like you said, there are parents who really should be working. There are women especially, who are not able to work because their kids are not in school. And, I've heard teachers say, well, moms just want babysitters, and they
Oh,
want their teachers to be babysitters.
I'm not a
And
babysitter.
I'm like, well, you know, I am a physician. I have a job. I don't want to lose my job. I have an education. I have a role to fill with my patients. And I think that it's important. And I think that all women and men who have a job that they're proud of, that they want to do, should be able to do their job. And even more so for lower income people, because, they need money. They need to go to work so they can put food on the table. And in order to do that, they're leaving their kids at home alone. They're, dropping their kids off with people, and maybe big groups of people. Maybe their
Yep.
kids don't have access to the internet. So it's like, it's created this crazy ripple effect throughout our entire country. And I don't want to force teachers to do anything, but teachers are so critical to the way that our country functions. basically, I just want to thank teachers for, filling that role, because it's huge. I mean, teachers have played an enormous role in my life and in my kids' lives, and it should never be undervalued. So, yeah.
Right. Well, I appreciate that, and I think that I agree. My first kind of take on this whole topic was related to one of my first passionate involvements in the topic over the summer about whether or not we would go back to school related to COVID safety, was because I love my kids and I know how much pain they are in because they tell me.
Yeah.
And I knew that there were kids that I would maybe lose, and I mean permanently lose,
Yeah.
if they couldn't be around their friends, if they couldn't do the things they were passionate about, if they couldn't even just socialize,
Yeah.
even socialize with a mask at 6 feet. Like
Yeah.
they needed to be in the same place with each other. And my thought was, that is my job. That's what I signed up for. Like that's providing those opportunities to them, is what that's what I'm fulfilled by. And I need that too for my own mental health. I need to feel like I'm making a difference. And
Yes.
so I know that by being back at school, and at least even though we're only there a couple days a week with each group of kids, at least I'm making a difference when I'm there with them, and that's such a huge deal. So I agree with you. I'm on the same page, and I know that the the audience of my show, I probably have a mixed bag of how people will feel about this, and I think but I think it's an important conversation, one that we need to have as a country in a non-political way. And I'm hoping that as the election results like settle down and the dust settles, that maybe we can move into a less political conversation around schools. But I do have one more opinion to ask you related to this.
Yeah.
So, as you know, we are now heading into kind of our fall seasonal surge of the virus. Cases are,
Yeah.
and hospitalizations. So not just positive PCR tests, which can be a
Yeah.
little sketchy, but so a true surge, right? Because of hospitalizations. What in your mind have we crossed, because of all the data that we've collected over the last 9 months, and what we know about what's going on in schools themselves and with kids and transmission to adults, all the things we've just discussed in the last hour?
Yeah.
In your mind, is there a threshold at which cases could get so high that you would say close down schools again? Or are we past that point into more of the compartmentalizing our response as a society, keep the schools open, but do other things to help the vulnerable people? Where do you stand on that?
I really think we need to compartmentalize with that, and look actually probably at each individual school. And I know in Wisconsin, where I'm from, that right now there's an issue with there just not being enough teachers. So they're remote, but they can't come back because there's so many teachers that are out who actually have COVID. Now, I'm not saying they got in school. I don't think that they did, but that's an issue. I mean, you can't have in-person school if you don't have teachers.
Right.
But and then I think we need to keep looking at the prevalence in the school. And I'm not saying we need to do testing of everyone, but if there's an outbreak in the school, hopefully we've been doing it in cohorts, like that cohort can quarantine for the amount of time that's needed. If there's an outbreak among staff, I mean, obviously each school needs to deal with that differently, and to have the staff certainly to quarantine or exposed. And I mean, the prevalence in the school has been so much lower than the community that it's been really, really hard for me to set a specific threshold, because everyone in the beginning was saying like, well, it needs to be below 5% a positive rate. And I thought, well, that's so weird, because it was higher than that in Europe when they opened the schools. So why does it need to be that? And it went fine there. And so I think, basically we need to be looking at it from more an individual school basis at this point. And I agree with what's happening in Europe, that they are keeping the schools open as that's like the last thing to close in addition to the essential businesses. So basically they consider school, like hospitals, like grocery stores, to be an essential business in those countries. And I have been unable to see it as anything but that. And
Right.
so, if a Walmart or a grocery store needs to close down because there's too many cases, they need to. But I think by, rule of thumb, the schools should be open.
Right, which is, of course, the politicization of the topic.
Yeah.
That also makes you a right-wing wacko. Like, you gotta back
Weird.
off, Tracy.
I mean, I am a wacko, but
Yeah. Well, yeah, and that's what's I think that's such a strange thing that part of how this is all developed is that if someone had told me back in February when I had first heard of COVID,
yeah.
that hey, 6 months from now you will be able to predict what someone's opinion about COVID is based on who they vote for. I would have found
I
that
know.
to be
It's
so
really
strange.
insane. Yeah, I mean, it was so interesting to watch, like, the day that Trump said that all schools should be open, like, suddenly every single liberal in the country was like, "What? Schools should never open." And it's
Yep.
like the tone of the conversation just completely changed among the physicians that I knew, among all my contacts, and I was like, "What happened?" Like, I thought we were looking at the science.
Right.
Yeah.
Yeah. Yeah, it's just super bizarre, and I appreciate you helping us think through it because I think um, uh, you're looking at this in a holistic way, which I appreciate because that's kind of lacking right now. When I say holistic way, I mean, yes, we need to look at the COVID science. You're no at no point in this conversation have you told us that COVID is no big deal and we should just throw away our masks and have a giant makeout party. It's not that's not what you're
Right.
saying, but
Yeah, no, not
there
at all.
not at all. Not yet, not till next year. Um,
Right,
but
after the
but that
vaccine.
but that instead that we look at that COVID science, the data related to that, and you in order to, like we talked about as soon as the conversation started, we were talking about balancing the risks from COVID with other things. My
Absolutely.
take has been the whole time that if you're going to balance the risk of COVID versus other things, you have to accurately describe what the risks of COVID are. And
Yes.
and that's been our challenge. And of course, yes, will we have more information a year from now that we have now? Yes, but it's no longer okay to just say, well, we don't know anything yet, because we
Right,
do
no,
we do
absolutely
know
not. Yeah.
stuff. Yeah,
Yeah, we know a lot, and we know that the fatality rate is a lot lower than we initially, suspected, and that's why the WHO is now saying we really shouldn't be using these blunt lockdowns and closures of everything, and why the schools are open in Europe. So,
right.
yeah.
Absolutely. Well, I hope that that you helped someone. I know that you helped me think through these topics and bounce my ideas off of you, and I appreciate it. And everybody, by the way, should go follow Dr. Hoch on Facebook, because that's where I found you, and just have really appreciated you've been just putting out long posts with the most recent information that you've come across. It's very thought-provoking stuff, and I appreciate it. I hope you'll keep doing that, and hopefully some of my audience will go find you on there and kind of keep up to speed with some of the latest stuff.
Awesome. Well, thanks. It's
Awesome.
been
Thank you so much.
Thank you.
All right. See you later.
See you later.
Okay, thank you so much for sticking around to the end of the episode. If you made it this far, then you get the science badge. Of course, you will get to wear that proudly as a metaphor for sticking all the way to the end of this episode and learning from the good Dr. Høeg for coming on the show and helping us talk through these topics. This is tough. Ultimately, we're talking about a situation where there is no awesome choice, right? And I think that's where a lot of our politicization has led us, because when we support a political party, we need to present that political party as being able to be the one that came up with the awesome choice. And that's how we convince each other to vote for that party. The problem is with this situation, there is no awesome choice. Once we all accept that, then we can actually dig into harm reduction as a philosophy and thinking about what is the path through the middle that we have to chart in order to get to that least harm possible. And that means being able to openly and willingly discuss the harms from keeping schools closed. And that means openly being willing to and accurately describe the risks of keeping schools open. Right. So what are the numbers? What are the actual risks? And like I said at the very beginning, that requires experts from more than just the fields of virology, immunology, epidemiology. That requires experts from everywhere. We need to be working on this as a society. So thank you so much. If you believe in this show and you found something valuable in this episode or any other episode on the feed for the Chorilosophy podcast, there are some things that you can do to help. First, head over to chorilosophy.com and leave some feedback. There's a feedback form there now that you can apply to be on the show, or simply respond, or sign up for the newsletter. You can join the Chorilosophers Facebook page. Another thing that's really big deal is when you head over to the sponsors of the show. So ryanmain.com, graphitepublishing.com, Sight Reading Factory, mymusicfolders.com, vocevista.com. You can enter Chorilosophy at checkout when you get any of those awesome products, and that helps a lot. Plus, you can interact with the show, leave a rating on the podcast app that you use, leave some kind of a Facebook rating on the Chorilosophy podcast page, share, like, help me beat the social media algorithms that make it hard for what you could, I guess, consider this show to be a small, independently run business. I mean, it is in real sense. And they make it really hard on us. Without your interactions, they bury it, quite literally. That's how the algorithm works. They want as much of my ad dollars as possible to get the information out to you. So you can help with all of those ways just by being part of the conversation, and that helps a lot. So thanks, everybody. I hope you got something out of this. And again, nothing in any of the COVID conversations that are published on my website, chorilosophy.com/COVID-conversations. There are several of them there now. None of them are intended to present to you the answer. Because like I said, there's not a great one. We're in the middle of a pandemic with a new virus that sucks. So let's just work together and try to find the best way through this. We can do it. Thanks, everybody.